Hello everyone, once again welcome back to MMS Makes Medicine Simple. So after vitamin A, D and vitamin E, the last fat soluble vitamin which we are going to study is vitamin K. So here we will talk about the functions of vitamin K, the daily requirements, what are the signs and symptoms of deficiency, what are the sources, and lastly the treatment of vitamin K deficiency. So before we start, I'll request you all, please do subscribe the channel and keep supporting. So with this important note, let's start it. So now we are going to talk about vitamin K, the last fat soluble vitamin in our series. So now see here. Our body needed this vitamin K for the synthesis of certain proteins, right? And these proteins are required for blood coagulation. Now see here. Apart from blood coagulation, this vitamin K is also very important for the binding of calcium in bones and other tissues. Not only this, there are certain bacteria which are present in our intestine. They naturally produce this vitamin K. So vitamin K is naturally produced by bacteria which are present in our intestine. Now see here, this vitamin K is also essential for the production of certain proteins. So what are those proteins? So those proteins are very important, prothrombin and the other factors which are involved in blood clotting mechanism, right? So see here, vitamin K is very important for the synthesis of proteins, right, which required for blood coagulation, also for binding of calcium, and lastly very important, right, for the production, for the synthesis of certain proteins like prothrombin and the other clotting factors which are involved in blood clotting mechanism, right? So vitamin K play an important role in the clotting of blood. That's why see here, very important. This vitamin K is also known as anti-hemorrhagic vitamin, right? Which vitamin is called anti-hemorrhagic vitamin? Vitamin K. Now see here, there are two natural forms of vitamin K. What are those forms? The first one, vitamin K1, the phyloquinone, and the second one is vitamin K2, menaquinones. These are the two natural forms of vitamin K. So what are the daily recommended doses of vitamin K? So the daily recommended dose of vitamin K in men and women is 70 to 140 microgram, and in children it's 35 to 75 microgram. So after daily recommended doses, now we will talk about the functions of vitamin K. So what are the important functions of vitamin K in our body? So now see here, the first function, very important. This vitamin K is very essential for the hepatic synthesis of coagulation factor. So what are those coagulation factors, sir? So those are coagulating factor 2, 5, 7, 9 and 10. Very important. Now the second function, clotting and vitamin K. So vitamin K prevents the hemorrhage only in cases when there is defective production of prothrombin. Second function. Now the third function, oxidative phosphorylation. So vitamin K acts as a cofactor in oxidative phosphorylation associated with lipids. Now the fourth function. This vitamin K is also needed for the carboxylation of glutamyl residue of calcium binding transport between the flavin coenzyme and cytochrome system. And now the last, the fifth function. This vitamin K also acts as a natural anti-inflammatory. Very important. So when we talk about the important functions of vitamin K, these are hepatic synthesis of coagulating factors. It also prevents the hemorrhage in cases where there is defective production of prothrombin. Also play an important role in oxidative phosphorylation, and it is also needed for the carboxylation of glutamyl residue. And lastly, it acts as a natural anti-inflammatory. So with this important note, so after functions of vitamin K, now we will talk about the deficiency of vitamin K, right? What are the signs and symptoms of vitamin K deficiency, right? So the common signs and symptoms are heavy menstrual periods, easy bruising, oozing of blood from the nose and gums, and not only this, also bleeding from the GI tract, right? Vitamin K deficiency can also manifest with blood in urine and stool, and also excessive bleeding from the wounds, punctures, right, and also from the injection and surgical sites, right? Not only this, vitamin K deficiency can also manifest with fat malabsorption syndrome, So these are the most common signs and symptoms of vitamin K deficiency. So after deficiency of vitamin K, now we will talk about the major sources which are rich in vitamin K. So now see here. The sources which are rich in vitamin K are green apple, green grapes, green pear, cucumber, avocado, kiwi fruits, limes, broccoli, onion, cabbage, carrot, and tomato and green beans. So these are the major sources which are rich in vitamin K. So we can take all these sources in our diet to replenish the deficient vitamin K stores, right? So in our previous slide we talked about all the major sources which are rich in vitamin K, right? Now we will talk about the treatment of vitamin K with supplements, especially in those patients who are severely deficient with vitamin K, and also for those who cannot eat all these dietary sources in their diet, right? Now see here, vitamin K can be given orally, right? Also it can be given beneath the skin in high risk patients for bleeding. Not only this, in patients with vitamin K deficiency and severe liver disorders, vitamin K may be insufficient, right? Vitamin K may be insufficient than the blood transfusion, right? That may be necessary in this type of patients. Now the fourth, it is also recommended that all the newborns given an injection of vitamin K intramuscularly to prevent the intracranial bleeding after delivery. Not only this, that's why, because by giving the vitamin K intramuscularly, especially in the newborns, we can prevent the intracranial bleeding after delivery. That's why most of the formulas of infants, they contain vitamin K, right? So thank you so much for listening, and please don't forget to subscribe the channel and also give your important feedback in the comment section. So stay safe, study a lot. Have a great day guys. Thank you so much.